sloppy practice. 32% are urinary tract infections. Okay, how do they get urinary tract infections in the hospital? Catheters. Urinary catheters. Okay, aren't we supposed to put them in under sterile technique?
Yeah.
All right, well, okay, so having a catheter in just makes you more prone to infection. But certainly the technique of how they're cared for can contribute to infection. So when you're putting a catheter in, you got a hole and a shot here, right? You got a catheter, you have to go into a hole, a urinary meatus. You miss, you're going to touch what? Skin. What's on skin? Bacteria. And where are we going with that catheter? The sterile bladder. The sterile bladder doesn't like bacteria. Because there's a great medium in there, urine, for bacteria to grow and multiply and colonize. And you got some elderly, immunocompromised, little 90-year-old lady. What defenses does she have to fight against that? Not much. She ends up with a urosepsis and dies. Because of what? Poor technique in a catheter insertion. And believe me, you don't think of it when you're putting that catheter in that you can be contributing to somebody's death. Because down the road, are they going to be able to trace that back to you? No. They're not going to know that it came from that catheter going in. They're just going to document a urosepsis here. So, I mean, you have to, if you're putting a catheter in and you touch the skin with the catheter, you got to get a new one. You don't go twice. Okay, because that's one of the ways that we cause infection. So what do you think the move in hospitals is today? What do you think? Should we be using catheters? No. Only if absolutely necessary. There are alternatives to getting accurate urinary output collection for INL. Okay, for men, there's condom catheters. All right? I mean, for women, there really isn't a good device for this, but, you know, we don't put a catheter in a patient for our convenience because we're frequently changing wet pads. Okay? And unfortunately, not all people are continent and able to ask for a bedpan or go to the bedpan. So we just have to check patients frequently. 22% surgical site infection. Pretty scary, right? That means we're not washing our hands before dressing changes. Or using proper technique with dressing changes. 15% are pneumonias. And most of these pneumonias are coming from where? You know, not regular patient pneumonia. They're coming from ventilator-associated pneumonia. A patient who's on a breathing machine. Because that would be a conduit to their lung, huh? Right? Because if somebody's on a breathing machine, there'd be tubing and you'd have to be suctioning them. And if you're suctioning out secretions and sputum, there's a chance that you could be introducing what into the lung? Bacteria. Okay, so ventilator-associated pneumonias. And 14% are bloodstream. How do we get the infection in their bloodstream? Regular IVs? Central lines. Central lines. Now these would be IVs that are going into a central vein. And the one that you're going to see most commonly in the hospital is the PICC line, the peripherally inserted central catheter. And you'll see some of them. The nursing home you might not see them so much, but when you get into med-surg, you'll see them all the time on the nursing units. And further down the line, when we do a couple different lectures, I will show you pictures of PICC lines. But usually they'll have a set protocol for the type of dressing change. And it's done under sterile precautions. You even wear a mask to prevent infection.
I was just going to ask that I had surgery for, I had laparoscopy for endometriosis in October, and I was sent home with antibiotics. I didn't finish my antibiotic medication, and 4 weeks later I had infection. I was hospitalized. I just wanted to ask if the reason why I didn't finish the antibiotic is why I got the infections. My brother-in-law pediatrician told me that.
Well, antibiotic, you shouldn't do the full course.
I didn't finish.
Because if the full course is designed to kill the organism. So if you don't do a full course, the organism can mutate and become stronger. And this is why we have such an issue with resistant organisms. Because antibiotics have been abused over the years and just overly ordered and, ordered by doctors. Because everybody wants an antibiotic when they don't feel well. So it has rendered a lot of antibiotics useless against some of these super infections, where there's very few antibiotics left that will, and this is more next week's lecture, because we're going to talk about this in depth next week.
I'm not sure I understand how you got the ventilator requirement. What was the route in?
Okay, if you're on a breathing machine, you're going to be hooked up to the machine, and you're going to have what? A tube that goes to your lung, and then you're going to suction that patient. So that suction catheter is going almost down the lung. So if you're not using proper technique, you're introducing bacteria right into the lung. Okay, that's how it can happen. Okay, so something to think about, right? This is from the CDC. What's the CDC? Centers for Disease Control. So these are some harrowing statistics, right? This is the website that I got I got rid of this slide. This is the website that I got the Joint Commission safety goals for 2011 also. So you don't have to worry about that. These are the old patient safety goals. I just figured I was giving you the updated one, so I didn't change the slide, because then you would all freak out. So these are the 2011 patient safety goals. So basically the same, but they just condensed it a little bit more. So it's identify, like the first one here is identify the accuracy of patient identification. This says identify patients correctly. And what do you think we should use to identify patients correctly? Two identifiers. Which two? Name and date of birth are the most accurate. And what the Joint Commission recommends. It shouldn't be name and room number. Why? Room numbers can change. Okay? So name and date of birth. When I was at St. Lawrence Rehab after my knee replacement, every time somebody came in, and I can't say this always happened, in other places, but every time somebody came in the room to give me meds, they asked me my name and my birth date. Every single time. So I was very impressed with that. Okay, very impressed. What's that? No, they didn't know I was an RN, no.
In the outpatient department, they actually use two nurses and they involve the patient. So the
Yeah.
patient looks at the medication, looks at everything and makes it.
Yeah, you should, not only should you ask, you should look at the name band, and you really should be comparing it. I mean, it depends if you have electronic medication administration record or not, but, I mean, you should be, all these checks and balances to make sure you've got the right patient, the right drug. And we'll talk more about how we figure this all out.
Do you get, like, so you're a nurse, certification, and you know this patient, like, every time you, like,
Every time.
even if I went in, I actually.
Don't take it for granted that you know this patient already. It's just good practice to always do it. Even though you've been taking care of them all day long, the last time you go in that room, and patients should come to expect it. Let me see your armband. What's your name? What's your birthday? Now, on patients who can't answer you, you're just going to look at their armband if they're confused or, whatever. But if they're awake, we ask them.
I was at Robert Johnson for 4 days, and all the nurses that came in, none of them ever asked me to give me medication.
Oh, hopefully, this New Brunswick or Hamilton?
Hamilton.
Oh, Eric.
Some of them graduated from here.
So what's that tell you? Some of them graduated from here, and they got the same lecture, so they didn't listen to their
I
instructor.
told them I was starting my nursing program in January.
Because you just heard me say it, no matter what, check it. Let me tell you, one time I was doing nursing for the last semester, and at that point, we don't follow them into the room to give every medication. We follow them into the room for IV medications, but not